Hey guys, welcome back to another one of these social proofs. I'm really happy to be here with you and thanks for dropping by. Today I'm sitting with Dr. Edwards. He's a vascular surgeon. How you doing?
Good. Happy to be here.
I'm just going to ask a couple questions just to basically get a fundamental idea out there as to how we work together, why we work together. But for those who don't know much about you and what you do, can you give us a little bit of background?
Yeah, absolutely. So I'm a vascular surgeon in Florida. I've been in practice around 5 years and did my training up in Atlanta at Emory University and Tampa at University of South Florida, and then joined a private independent practice around 5 years ago, which has been a great move.
Cool. So, what challenges were you facing before working with me, right? And what problems were you having?
So I think really where we were, our situation, I think, is unique in that I came in and joined a really well-established group of people that has had a very good local reputation for a long time. But what I found is that we were in this scenario where we know that we're providing world-class care. We're very academically oriented, even as a private group, and we have a lot of internal conversations and a lot of internal collaboration that we think sets us apart, and we're really proud of that. But if everything that we're doing really only exists in this echo chamber, then are we really able to build a brand? Are we really able to share our expertise with the larger, not only the medical community, but also with our patients? And so when I came into this group, my more senior partner said, "Okay, Jeff, we want you to go work on marketing." I'm not a marketer. I don't know what that means. And so it was, once I got linked up with you, Vic, through actually other clients of yours that we were working with in another sense, we had our first several conversations really just talking about the concepts and what it means to have a brand. And I think it was a shift in thinking from the very beginning, in that, I think as a medical provider, as a surgeon, I feel like there's almost this stigma around marketing. If I'm marketing, then is it that I'm pitching something that, is my reputation not good enough that that's driving business? Is it that, I feel like I have to peddle myself or I'm selling something? No, it's that it's taking this brand that we all have. Everybody has a brand. Every practice has a brand. But if you don't build your image around it, if you're not putting that forward in an active sense, then you're really doing yourself a disservice.
Yeah, I agree. I mean, it wasn't until the early 80s or something like that when it actually became legal for physicians to be able to actually market themselves, right? So it wasn't part of your DNA. And then you have market forces, right? The internet comes out and, well, patients, we people are going to look for information online. And specifically when it comes to healthcare information, we want to be informed. And that's the beauty about the internet, that we're able to access information when we want it and how we want it.
Yeah, it's the information is out there, and people are going to go, in my case, people are going to go looking for a vascular surgeon because they hear from somebody that they might need one, or they see, I've got these veins on my legs, I need to find a vascular person. Well, I think they're going to be a lot better off if I'm the one giving them real information rather than them relying on the vast internet to judge what's real, what's not, what's accurate, what's not, to drive the conversation.
Well, let's zoom out. What actually did we do together? What was the experience like?
So we started out with several Zoom calls. I'm in a group with other partners, but I'm coming at this from the perspective of, all right, I just met Vic. Vic's here explaining to me what branding and what marketing means and how we can do that. But I've got to take that back to my partners in a way that they're going to understand it and be willing to get behind this. And so we started out and had a series of conversations. And I think that probably took place over 6 months or longer. And a lot of it really just you getting to know me, you getting to know us as a practice from my viewpoint, and me really understanding what it is that you do. That's not just, okay, let's do some search engine optimization. Let's make a Facebook page. Let's just do the sort of cookie cutter, here's the generic medical marketing package, because that's not what this is. And so it took a bit of discussion, I think, to get on the same page, all in a very positive and productive way. And so once we did that, it became very clear to me that, okay, Vic is thinking about this in a different way than virtually anybody I've ever encountered in marketing, in digital marketing and branding, because you're really kind of coming at this from all angles. And so once we established that this is going to be really good for our group, I think we're going to be a really good fit. We had you come down to Florida. We sat down. We had a conversation together, really kind of rehashing what you and I had already established, but with all my partners. People say in medicine, any sort of change is like steering a cruise ship. It's really slow. It takes a lot of effort. But once we all sat down collectively as a group, everybody was very impressed, really understands the theory behind it, understands the method, and everybody was all in. So once we agreed that we were going to work together, from the very beginning, it was very thoughtful, very organized, very easy to work with you. And I think a lot of that because you put so much effort in on the front end to build a structure that we can adhere to. But you also have been working with surgeons and long enough to know that our schedules are unpredictable. We're going to tell you we're going to be there at 1:00 and we'll show up at 2:30. And so you're flexible and we're flexible. And that, I think, helps big time. And so we started out doing as much as we could, sort of back end building. We were going to build a new website. We really we didn't rebrand the practice. We just refreshed our image as far as our logos, our website. And those are all things that we started from the very beginning. But then I think it really came to fruition when we scheduled that first on-site visit. You came down, I think you spent 8 days or so with us that first visit. And I have to say, everybody was completely blown away, not only by your professionalism, but also just how much work was packed into that week. We've never done any sort of production. We've never done any sort of filming or video or anything. And so, okay, you're just explaining, this is what B-roll means. This is the microphone. Look at this camera. And what at the beginning felt kind of awkward, you have a way of really kind of putting everybody at ease, making it conversational. And when you left after that first week, everybody kind of came to me and they're like, all right, Jeff, I'm not really sure what just happened. Vic videoed a lot. He took a lot of pictures. Let's see what this looks like. And then, a month later, it seems like as you started to take all that content, slice and dice it and start putting it on the new website, start actually getting the social media programming rolling out. And then everybody's just seeing this flood of just excellent quality material across all fronts. It was just mind blowing, to be completely honest.
Yeah, no, I appreciate it.
Yeah. And then people start getting love from their family and friends if they're seeing all this content come up, and it really starts to reinforce just the power of what we're building.
Yeah. And, what I think is important is to be able, we talk about having purpose behind what we're doing, right? Like we're all, me, you, and everybody in between that has typically work online. We're all navigating market trends, right? What should we do? How should we do this? I mean, I obviously think that the safest way to do things is to provide the right kind of data behind the content that we're producing. And if we're going to produce content, we have to understand that there has to be a structure and a framework to that. That is not just about randomly throwing content out there. But ultimately what I like to do, I mean, we talked about the structure on the front end of that, right? Because it's important to remain nimble. Yes, working
Absolutely.
with groups or, whatnot, we have to have a system associated to that. But the end result is always the patient, right? How are they receiving this information? Not just the patients, but folks at the hospital or your peers or whatnot. Can you talk to that? Do you think your patients have gained value from the content we've been producing together?
Yeah. So some conversations that we had internally as we were kind of getting this process started and just beginning to understand what it was that we were going to be setting out to do. I think one aspect of that became very important to us was the notion that we're not just making content for content's sake. We are making content that is educational, that is intended to alleviate our patients' fears before they're coming in for a procedure. We're making content that is intended to make our patients feel like they know who we are before they come into the office, because, sometimes the things that we're discussing can be really distressing and really scary for patients. And we're talking about surgery, and that is something that, we take very seriously, and our patients take it very seriously. And so what we kind of went into this with the perspective of, we're doing this to build content for our patients so they know who we are, so they can be informed and they can ask the right questions and they can get the most out of our interactions together. And I think that is what helps us to be more genuine and really keep the ultimate goal in the forefront, which is patient care.
Exactly.
And so, yes, it's branding. Yes, it's marketing, but it's just taking the conversations that we're already having with our patients, we're already having with each other, and putting it into a format that is easier to digest and that's available and it's easy to find.
Yeah.
And that made it really easy.
Yeah. Last couple questions. Like, where do you think you would have been if you hadn't worked with myself, my agency, Paramount MD?
So we would still be spinning our wheels with our, we had some social media sites. We were doing our best to publish content that in reality and in hindsight some of it was cute, and it was a lot of content that it is important to showcase the office. It's important to showcase the staff and the family that we have here together. And that's still a component of what we're doing, working with Paramount MD. But we are then also loading that with all of this patient information and all of this educational content that we really weren't equipped to do beforehand. And so if we hadn't just started working with Paramount MD, I think we would really still be relying entirely on our word of mouth. We would be really inefficient with how we're, quite frankly, spending our marketing dollars, because we are putting those resources into efforts that we're not tracking, we're not measuring. We still are very supportive of local sports teams and local organizations, and we all individually do sponsorships. But in terms of having a cohesive front where we can bring all of that together in a way that actually provides additional services to our patients, we were nowhere close to that.
And if there's anyone who is maybe on the fence about working with us or booking a call to speak with myself or anybody on my team, what would you say to them?
There should be no hesitation in having that initial conversation with you, because quite frankly, I probably learned more in that initial conversation with you than I would have in reading 5 marketing books on my own, because you're coming to me as somebody who has really experience in every facet of marketing, not only from the creative, but the digital side to the back end building, really the nuts and bolts, that quite frankly, that would be another job for me to try to learn that. And we shouldn't be doing that. We should be taking care of our patients. And once we had our initial conversation and you were just really, quite frankly, you were educating me, and that's really all it was about. And so that for me, when I kind of reflect back on what our experience has been, those first several conversations that we had, they were conversations I really looked forward to, because I enjoyed getting to know you as a person, but also getting to know kind of where you're coming from with your business. And it was very refreshing, because it's different than what else is out there. I don't know where else I'm going to get that quality of interaction and that quality of education for me. And that's what made me, from the first 1 or 2 conversations that we had, I knew this is going to be great. We just have to get there. And now we're a year into this and we can't say enough good things. Our patients are so impressed with what we've built. The medical community, everybody asks who we're working with. Who's doing all your content? Who's doing your website? Where is this coming from? And I'm like, you got to call Vic.
Well, I appreciate you giving the good word out there for me. And as you know, I'm big on relationships and deploying trust building systems. Right. And that's basically what we have to do. I mean, the cherry on top is that the creative looks a certain way. It's professional in the day and age that we live in today. And obviously during COVID, misinformation or whatever's out there, and we implement strategies that people trust us because they know we're aligning, who we are, our expertise to the market. Kudos to all of you, because I'm impressed with not just yourself, but everybody in your team. So I just want to say thank you for doing this and sitting here and taking the time to give this testimonial for me.
Absolutely. Happy to do it.
All right, man. I'm wishing you success, and we'll talk in a few.
Always a pleasure.